All right, so it looks like we have quite a few people in. Let's go ahead and get this party started. What do you guys say?
Woo! Let's do it.
All right, so my name is Ann McGowan. I am the Regional Office Manager for Vios Fertility Institute in Milwaukee. I have been with the company for almost 2 years now, and I have the honor and pleasure of working beside our Dr. Ellen Hayes almost every day, whose passion project really has been wellness. And since starting in the world of fertility, I, as a fertility patient, had no idea what a connection there was between wellness and fertility. I just thought, hey, live a healthy lifestyle. But it turns out there's a lot more that goes into it. So working beside Dr. Hayes and her big, beautiful brain has been an honor for 2 years. And so I'm excited to hear what all of our doctors have to say. I'll go ahead and start the slideshow and we will get going. All right, I will go ahead and turn my camera off. You guys aren't distracted by my beautiful face here. All right, so thank you everyone for joining us today for our Optimizing Fertility Wellness webinar. This webinar is really cool because I have the pleasure of sitting beside Dr. Ellen Hayes and Dr. Violet Klenov, who are our co-directors of our Vios Fertility Institute Fertility Wellness Center of Excellence. Really exciting things happening, and joining them will be our very own Dr. Angie Beltsos of Vios Chicago. She is our CEO and Chief Medical Officer, and we are thrilled that she could join us for this webinar. And I don't know if I mentioned, but Dr. Klenov is with us at Vios in St. Louis. So with that being said, Dr. Hayes, I will hand it over to you.
Thank you, Ann, and thanks everybody who has joined us tonight. It's great to be speaking about this. I think a lot of our mutual patients are really interested in wellness topics in general, and then in particular when trying for pregnancy, and especially when having difficulty conceiving. So that's really why we have put a focus on fertility wellness, because obviously infertility really affects a lot of people. It's millions of reproductive age individuals and couples. The stats are usually quoted as 1 in 6 or 1 in 8 reproductive age couples. And there are a lot of diagnoses with infertility that are incredibly frustrating and difficult to treat. And so we want to try to optimize overall health and wellness to get the best results that we can for these patients. So diminished ovarian reserve, PCOS, male factor, unexplained infertility, recurrent pregnancy loss, all of those things are incredibly frustrating for patients, and they want to be able to participate in their care as well. So what we've learned over the last few years is that improving overall health will significantly improve fertility, and it can really make a big difference as far as chance for pregnancy when patients move forward with fertility treatment. And like I mentioned, patients feel fairly out of control and stressed when they are diagnosed with infertility, or even prior to seeing a specialist like an REI physician. And they really want to regain some control over the situation. And these are really great ways to move forward with a healthy lifestyle, for lifelong changes, but in particular to kind of focus down on their fertility health.
All right, so the mission of our fertility wellness program here at Vios is to assist fertility patients in adapting and maintaining healthy behaviors in order to optimize the chance for pregnancy and improve emotional well-being through fertility care, through individualized holistic lifestyle recommendations designed not to just treat them at this point in their life, but to treat just kind of them generally as a human being and throughout the course of their lives, including their reproductive lives.
And some of the basics are so fundamental. I was talking to a couple today, and they were asking, like, what else can I do besides some of the, IVF medications and coming for these appointments? appointments, which can be all very quite stressful. But some of these things that have become much more common now, smoking and vaping are two things that can hurt the egg and the sperm, as well as like social drinking is okay, but not trying to, minimize how much of that is being done in your daily lives. Coffee, of course, is important to keep us awake, but minimizing how much caffeine is brought in can be very important to our results of our success. And now that marijuana and edibles are much more used and legal in different states, it's important to remember that those can impact the results of how the egg behaves as well as the sperm. So we recommend being careful with that as well.
All right, and importance of healthy weight in our patients who are hoping to conceive. So we do talk a lot in BMIs, as you guys know in your practice as well. It's not a perfect measure, but it's what we've got, and we've got good data about outcomes in BMI. So a normal BMI, 18.5 to 24.9, those patients have the highest chance for pregnancy in the literature. And I focus here on overweight and obese patients. Underweight, there are some issues as well. I'll say if you guys are kind of like us, we tend to see the overweight, obese end of the spectrum more frequently than the underweight. So I'll focus on that. These patients do have a longer time to pregnancy. They're at both spontaneous and with fertility treatment. They're at increased risk for having ovulation disorders. They're often presenting with irregular menses, even outside of PCOS, just irregular menses and higher risk of anovulatory cycles. They have a lower chance for natural conception and reduced success with fertility treatment. Depending on the studies that you're looking at, that ranges from as low as 10% to as high as 30%, which is significant. Additionally, overweight and obese women have an increased risk for miscarriage. This risk is often 2 times higher than their normal weight counterparts in some good studies. Additionally, their losses tend to be more euploid losses, so genetically normal losses as compared to aneuploid losses. So likely there is a uterine factor that is influenced by the obesity and those altered metabolic parameters that's probably predisposing women to increased risk for miscarriage. Additionally, there's, as you guys know, increased risk for procedures requiring anesthesia. And then not to forget about the male partner. So sperm quality is affected by obesity and overweight as well. There's increased kind of oxidative stress markers and semen parameters from overweight and obese men. They also tend to have a lower sperm concentration and worsened sperm motility. But there's kind of light at the end of the tunnel. So I talk to patients about this all the time. Even a 10% weight loss can have a meaningful improvement in their outcomes during fertility treatment. And some studies suggest even a 30% increase from that 10% weight loss. So it can be really motivating for patients when we present this data. Right, and I love this graph. So I use this a lot in counseling my patients because it's kind of hard. We talk and, hey, what are you doing for diet, lifestyle? This is your BMI. I like to show them this graph and say, here's your pregnancy rate when I do infertility treatment. When I do IVF, your pregnancy rate per embryo transfer by BMI. And you can see this purple line is the pregnancy rate, and it's just a steady decline with increasing BMI. So the ideal group is the normal weight. This is a nice graph to point out that, hey, if you're underweight, you're also doing yourself harm in terms of outcomes with treatment. Most of this data you could probably extrapolate to spontaneous pregnancies, but I don't have the literature for that as readily available. But then you go into the obese range, and your chances for success are dropping, 10, 15%, your pregnancy rate as well as your live birth rate. And then down on this graph below in B, the miscarriage rate, it goes up with increasing BMI. So sometimes it can be helpful, and you just say, if I could just get you into this category, from obese to overweight, from overweight to normal weight, here are some really tangible kind of improvements that I would see with treatment. All right, and then, another part of counseling here. So what do I eat, doctor? How do I lose weight? What can I do to improve my fertility? And luckily, there's a lot of information at our disposal. It's just going to be sifting through what studies really actually we see improvement in. And a lot of these are big prospective trials. And generally, the common theme is that plant-based diet, Mediterranean-based diet, has the best evidence or best association with increased fertility in these large cohorts. So that means more vegetables, fresh fruits, fresh vegetables, whole grains, legumes, low mercury fish, increasing omega-3 fatty acid consumption through food. And the biggest diets which we see good associations with improvements in, or associations with fertility, is whole food, plant-based diet and Mediterranean diet. And some studies suggest even a 20% increase live birth with those dietary changes. So when patients are looking for guidance, I will point them to kind of either of these two. Obviously, we want something sustainable, and these diets tend to be sustainable. They're not these crash diets where you're eating bacon and butter all day long, as fabulous as that might be. Generally, you want something that's a little bit more well-rounded, something that they can sustain for multiple years and hopefully in their pregnancy as well. A lot of our patients want books, they want data, they want to look at these things. I will point them to this Jorge Chavarro book. He's a Harvard researcher, and he wrote this fabulous book called The Fertility Diet, and just talks about dietary choices and patterns that are associated with increased rates of ovulation, increased fecundity over time. And he does a great job. So the takeaway is really to reduce your meat intake. So not just red meat, but overall, generally reducing your meat-based protein sources. Dairy is probably okay. Likely choosing the full-fat dairy over low-fat. Just I kind of explained to patients is that you want as little done to your food as possible, reducing kind of the processing of the food that you're eating, reducing your saturated fat intake, refined carbohydrates, so reducing those, including the ones that you drink specifically from those sugary drinks, that's low-hanging fruit. And then I talk a lot about reducing processed and ultra-processed foods, as there's newer literature coming out that a lot of those the more we do to food, the more potential inflammation that it can cause. The byproducts of how we process food, the preservatives in food, the artificial sweeteners, all of those kind of foreign chemicals can induce inflammatory reactions throughout the body. And we're kind of starting to learn what impacts those food choices have on ovarian and sperm health. And the kind of short story is that it's not positive. And so I kind of counsel patients to avoid anything that comes in packages, saran wrap, do the periphery when they go to the grocery store. Fresh, local is going to be the way to go. Just for your reference, the literature available in terms of specific food choices and the data suggesting improvements or potentially adverse effects on fertility from things like carbohydrates, fats, the type of protein that you're eating, vitamins and minerals, which we'll get to in the next slides. But there's got a decent amount of pretty good literature. Like I said, mostly observational studies, but at least things we can kind of hang our hat on when we're counseling patients. Also something to put on your radar, not only just your dietary choices, but when are we eating? What is the interval between meals? So intermittent fasting has gained popularity in other kind of medical subspecialties, cardiology, for instance, endocrinology. And in our world, it's really hitting as well. And so what are we seeing in terms of alterations in these metabolic parameters, following something like intermittent fasting, especially in these patients that we see with ovulatory dysfunction, polycystic ovarian syndrome, hyperandrogenism? Likely this diet might have some beneficial effects specifically for those groups, but maybe even broader. So we're waiting for better studies, but it's promising, especially in your kind of insulin resistant patients, your PCOS patients. It might be something that could help improve rates of ovulation and potentially improve some of their metabolic dysfunction as well. All right, vitamins and supplements. This is a big one. I'm sure you guys get asked this all the time when you're seeing patients hoping to conceive early in their journey. What can I do? What can I take? What's the right vitamin? I think we all will generally say eating, getting all of your micro and macronutrients from your diet and eating a kind of a varied rainbow diet is going to be the absolute best thing you can do. Yes, getting your vitamins and minerals from your diet is the best. It's hard for us to do that all the time. So what can I take? What's been, evidence-based recommendations to improve, or what things are associated with improvements in fertility outcomes? And I take a lot of this with a grain of salt. So these studies aren't great either. And so when I counsel patients, it's what's a low risk, low harm, low cost potential improvement to your treatment. But there's nothing super solid, like I'm going to just double your chances for success if I give you this vitamin or supplement, but it's easy and it's cost effective, all of those things, low risk. So definitely things that can help. Folic acid, obviously to prevent neural tube defects, you want all your preconception patients on a folic acid, but interestingly, there's some data suggesting improvements in live birth rates when we do assisted reproductive technologies in women who take 800 micrograms or more. Most of your patients are taking 400 at a minimum. Most prenatals tend to have more than that. There are some studies suggesting improvements in our outcomes when we do things like IVF. Vitamin D deficiency is a huge one. We're diagnosing vitamin D deficient people kind of left and right these days, especially here in the Midwest. So less than 30 for vitamin D, they tend to have reduced success rates when we do things like IVF. And that success rate can be reduced as much as 20% in some large studies. So definitely recommend supplementing them probably with like 50,000 units weekly until they're above that 30 benchmark to be in a healthy vitamin D range, and then maintaining them following that prescription conclusion. Antioxidants can be helpful as well. So again, no huge trials in humans, but animal data is promising that potentially we could improve the metabolics of an oocyte, especially of an aging oocyte. The dose I tend to use is 200 milligrams POTID for CoQ10. The more easily digestible format of that is something called ubiquinol. They can get it over the counter. Amazon, I tell them to try to get something from a North American company where you know where it's sourced. Myo-inositol is a supplement for improving insulin sensitivity, can be very helpful for women with PCOS. There's some good data out there in terms of improving metabolic parameters. I'm still waiting for kind of live birth data there, but can be is very, very promising and can improve some of those derangements. Metformin I use if they're insulin resistant. I start at 500 and work my way up to 1,500 milligrams daily. I tend to use it when they are when they have abnormalities on their glucose testing and have PCOS. And then we at Vios have kind of a collection of already kind of put together micro and macronutrients to use for patients who have difficulty with egg reserve. They have diminished ovarian reserve. They have PCOS. They have male factor infertility. That kind of combines the evidence-based kind of treatment in one tablet from a pharmacy that we know and trust in Canada. So we offer that to our patients as well, and to yours if you're interested.
All right, thank you, Violet. And I'm going to take over and talk about exercise and fertility. So I think it's a common misconception, and I think it's propagated by physicians as well. Many women believe that they need to discontinue exercise when they're trying for pregnancy, and certainly when they're doing fertility treatment of any sort in order to get best results. However, exercise has been found to be beneficial essentially to all, and as well as people trying to conceive and with fertility treatment. So we can see improved outcomes when patients maintain exercise. Sometimes they have to modify exercise, but they don't need to discontinue that. So some interesting information, people have studied whether normal weight women who exercise versus have a sedentary lifestyle, do they have an equivalent chance for pregnancy? Is their fertility compromised at all with a sedentary lifestyle? And it seems to be. So BMI is not the whole solution. There are benefits from exercise above and beyond just being at a healthy BMI. There was a meta-analysis in 2019 concluding physical activity alone, whether or not dietary changes were made, could potentially double pregnancy rates compared to patients who were not participating in any exercise. And it can be especially beneficial for some of the types of patients we've already talked about, those with obesity, PCOS, as well as insulin resistance. So we know that it can benefit everybody, but the recommendations need to be tailored to the individual and their situation. Now, there are going to be women who over-exercise, have very low body fat, stop menstruating, stop cycling, stop ovulating. Those, I feel like we can all agree, are probably the minority of what we're dealing with. And we're probably dealing with more women who are in a normal BMI range, and then many that are overweight or obese. And so when women are in a BMI range less than 25, so a normal BMI, the recommendation for optimal fertility is moderate exercise, but keeping it below 5 hours per week. It seems that above 5 hours per week can actually lower fertility. So what that equates to for most people, ideally, is about 4 to 6 days of moderate exercise for 30 minutes. And when patients ask you, well, what can I do? What's moderate exercise? That would be things like walking 2 miles in 30 minutes. That would be bicycling 5 miles in 30 minutes. That would be swimming laps for 30 minutes, you know. So there are many things that they can still choose from. And we'll touch on a little bit more, you know, what's important to tweak and change during fertility treatment cycles per se. When women have, there's a typo here. So when their BMI is over 25, so they're overweight or obese, these women seem to have their best fertility when they exercise more vigorously for 30 to 60 minutes a day, 5 to 7 days a week. And that's not only weight loss, but at this level of exercise, many people will experience weight loss, but it's also lowering insulin levels, reducing inflammation. There's kind of a myriad reasons why that can be helpful for women in that weight category. And to not forget about the male partners, they can basically follow the same recommendations. However, if you have a male partner who loves to cycle, it's best if they limit that to less than 5 hours per week. That seems to be a threshold above which we start to see impaired semen parameters. So if we want optimal sperm quality, we don't want cycling in excess of 5 hours per week. So the bottom line is we want to encourage our patients to stay active while they're trying to conceive. It improves their overall health. It will improve potentially their success with treatment, improve sperm quality. And this is really independent of whether or not they experience weight loss. So this can decrease their time until conception. And very, very importantly, it not only has physical benefits, but can improve mood, decrease depression, improve sleep, all of these things that can be very much disrupted with the stress of infertility itself, as well as fertility treatment. So we can't underestimate the emotional benefit as well. And just remember, the intensity of exercise just needs to be modified to lower impact options during fertility treatment, especially in our world when women are actually in the process of ovarian stimulation for IVF. We'll often ask them to dial back any high impact exercise. So runners will have them stop running, or really light jogging. I usually tell them to kind of reduce things down to walking. There are forms of yoga that can be okay. There is swimming, as long as they're not doing flip turns. So there are definitely some things that they can still maintain, still keep feeling good, feel like themselves, and stay healthy to improve their chance for pregnancy during their fertility treatment, even with IVF. So my next topic is stress and emotional wellness, which is a big one when it comes to patients with infertility. Obviously, it's incredibly stressful. So they've studied this, and we know that stress levels with a diagnosis of infertility, as well as during fertility treatment, can actually be equivalent to getting a diagnosis of cancer. So it's incredibly stressful for these patients. And many of them will meet clinical criteria for depression or anxiety at some point during their journey. This is not just the female partner, but the male partners as well. And believe it or not, in the state of Wisconsin, where fertility treatment is not mandated as far as insurance coverage, for those of you in that state, in Missouri, where patients can have a lot of stress surrounding financial difficulty proceeding with treatment, far and away, the biggest reason people discontinue treatment is not necessarily financial, but stress. So they emotionally feel drained and they feel that they can't move forward with treatment for that reason. So we want to help these patients from the get-go manage their stress so they can participate in treatment and so they can stay in treatment until they're pregnant, because that's what we all want. We want them to have success and to have the family of their dreams. So we want people to understand that we know that they cannot eliminate their stress, but that we want to help them manage their stress. So one thing that is very important, because in this patient population, there's a lot of scrutiny of oneself, self-blame is really common. So we want to reassure these patients that their stress is not causing their infertility. That would be very uncommon to be the sole reason that stress would be leading to infertility. However, the brain is connected to the body, so we don't want to underestimate the impact that stress can have on pregnancy rates and success. So we want people to understand the importance of this, and studies have shown that women in the highest quartile as far as stress levels compared to the lowest quartile can have IVF success rates that are even 50% or more lower than those that have lower stress levels. And this is difficult to study because you have to remember that perhaps some of the women with the highest stress levels going into their IVF cycle may be the ones that have been told that they have a very serious diagnosis like diminished ovarian reserve, may have a lower chance for success already. And so these studies can be tricky, but it does show some impact on stress on success rates with the fertility treatments that may be recommended. So waiting until people are at their maximum stress level probably isn't the best way to approach it. A proactive approach to stress management is really best to optimize pregnancy rates and to reduce patient dropout from treatment. So really, it's our job to bring this up to patients and to help them kind of find what works, make suggestions. So the three big ones that can be incredibly beneficial that everyone should really be focusing on, and people may not really relate this to their stress level, would be making sure you're getting good quality sleep, regular exercise, and eating healthy food. All of those changes or maintaining those things during fertility treatment will equate to lower stress levels. And so then above and beyond that, it really kind of becomes patient preference and what works best for them. So a lot of patients will participate in yoga and meditation. I encourage that in my patients. And we want them to feel supported. So whether that's with an actual psychologist, a counselor, or through participating in support groups, some of which are live support groups, but nowadays more often are on social media. So chat rooms and following Instagram accounts, things like that are actually really appreciated by a lot of fertility patients, just to know that other people are going through a similar situation. And other things that you may not be aware of, there's actually apps for your phone called Ferticalm for women and Fertistrong for male partners that are apps designed by Dr. Ali Domar with Boston IVF at Harvard Medical School. And she's come up with apps that are specific for fertility patients and give them kind of ways to change their cognitive approach to different scenarios that can be very stressful during the fertility process. And so there's a version for women and a version for men that they can just put right on their phone and have at their fingertips to sort of flip the script in their head. And people have found this very beneficial as well. Dr. Domar is a long-standing researcher and PhD studying psychology and some of the emotional wellness aspects of fertility care. So her apps are amazing. And then there's acupuncture, which sometimes we'll discuss with patients for medical indications, but can be very beneficial for stress reduction as well. So just to kind of build upon the acupuncture aspect, because I'm sure a lot of your patients will ask you, you know, should I be doing acupuncture? When should I be doing acupuncture? You know, it's difficult to look at data in a meta-analysis and see a true effect. So a lot of the meta-analyses are not conclusive. The reason that it can be really difficult to capture the true effect is because really there's not consistent protocols study to study. And even within a certain provider's practice, they tailor protocols to the individual. And so it's really difficult to compare apples to oranges in a lot of these acupuncture studies. Even down to how they perform sham acupuncture can be different. Some will have their control group not do acupuncture at all. Some will have fake needle insertions. Some will insert needles, but just in different medians and so, or meridians. And so the studies really are apples and oranges. So a lot of these bigger meta-analyses, including the Cochrane review in 2013, did not show a conclusive benefit. But there have been many smaller studies looking at more specific outcomes that have shown benefit. And some of the things that we've seen are improved ovulation in PCOS, reduced pain or the perception of pain, increased blood flow to the reproductive organs that can be altered with acupuncture, improved pregnancy rate when acupuncture is performed before and after embryo transfer, and for male partners, improved sperm quality, and then of course the stress management aspect can be huge. So important to remember that, and I advise my patients about this when they inquire about acupuncture. I tell them that if you ask an acupuncturist if they have experience treating infertility, I've yet to find one that will say no. But there are some that have more experience than others and might be a better fit for our infertility patients. And so it's really finding people that you trust that are doing a good job with your patients. And there is a special certification called ABORM, which is American Board of Oriental Reproductive Medicine, that some very select acupuncturists have achieved that certification. And those are definitely ones that have extra training in fertility acupuncture. And so if that's a provider that's available for your patients, that's a great one to steer them toward. So at Vios, we do offer in our IVF center in West Loop of Chicago, we offer acupuncture before and after embryo transfer. And we work with a great group called Aligned Modern Health. And so we've actually looked back at our data from May 2018 to April 2020, and we reviewed 654 charts. And actually these providers have this accepted at the ASRM conference to present, because we have seen a statistically significant improvement in pregnancy rate for those patients who do elect to do an acupuncture session just prior to transfer and just after. So overall, we are seeing 66.8% pregnancy rate compared to 56.6%, and that was statistically significant. And for those who were transferring a PGT tested or a euploid embryo, the difference in pregnancy rate was about 74% with acupuncture and about 63% without. So clinical pregnancy rate was also improved, 60% versus about 47%. So we thought these findings were really exciting. Our patients really like it. And I know Dr. Beltsos can speak to this too. I've noticed that the patients that have acupuncture performed in the office before and after truly have a great experience, you know, with the whole process, including the transfer. They're very stress-free and mellow, and obviously it's reflected in their success rates as well. So it's very exciting.
I absolutely agree with that. You know, one of the patients that did a transfer today just felt like the experience of that transfer was much calmer than the 3 or 4 transfers that she had had at another center, and felt just light and calm and more mindful than running in and having a transfer directly. Other questions that people ask us about wellness include the environmental toxins, and we wonder how these common endocrine disruptors are affecting our children and affecting adults, women who are trying to get pregnant. One particular area of interest has been BPA and the phthalates. These, first off, in regards to sperm, we have seen lower sperm counts in the United States and across the world in these recent generations. And the EPA, the US government, is studying male fertility, also based on even animal models, like looking at fish that look more like girlfish than boyfish. They look at human studies as well, and sperm counts have been going down, including count, motility, and the shape of sperm, but not only the quantitative measures, but the qualitative measures. And looking at sperm DNA seems to be more fragile in the men of this generation. And they're looking and seeing if these are related to these higher BPA in the environment, but also the phthalates have noticed lower testosterone levels and lower overall sperm parameters. When we look at the effect on women, BPA also is lowering estrogen levels. We get less egg yield, as well as looking at how these egg and sperm behave in our dish. We're getting lower fertilization rates when BPA is present, as well as when the embryo is placed into the uterus, how it affects the implantation, how the human embryo is implanting in these uterine environments where BPA is higher. Now, endocrine disruptors not only could affect getting pregnant, but also staying pregnant. People that have had recurrent pregnancy loss, and we all have seen these patients, they're 30 years old and they've had 7 miscarriages, and we're like, what in the world is going on here? And in looking at the history of RPL, those women may have higher BPA levels. And people say, well, where would BPA come from? For example, plastics are a strong etiology of these, for example, water bottles. You know, higher BPA levels have been correlated when women are pregnant with higher miscarriage rates, as well as the phthalates. So these are all becoming very concerning when we look at the impact of fertility in men, women, but also other areas of medicine as well. People have looked at where do these things come from? We see that they're in the water. And you know what's very interesting is different states have different threshold for what they're calling safe water. And some levels that might be okay in one state are actually considered toxic in other states. So looking at some of that just is mind-boggling, how much we tolerate and what the actual government and politics can play a role. So using filtered water can be helpful because some of these are not always safe directly from the faucet. Organic issues have been also studied, reducing mercury in the seafood watch. Those are interesting as well. And avoiding preservatives, like Dr. Klenov had mentioned, you know, things that are in plastics and things that have been more preserved with artificial sweeteners that have very low caloric intake but have fake sugars may not be safe. So they say if you can't pronounce it, don't consume it. An area that we take for granted, and I've just been really blown away by the makeup that we place directly on our skin, has also had very negative effects on hormone levels. And hormone affecting, again, young women, average aged women, and menopause. These are makeup can have toxins in it that change hormone levels. And that also extends into lotions, body washes, and even shampoos. So be mindful of these and the sunscreen that you're spraying on yourself and your family, that they are more cognizant of how these toxins might affect fertility. When we talk about the home and the environment, the plastics can be in contain BPA and PCBs, and these are very negative to female hormone levels. So try to get the glass or stainless steel to put your water in, and on the bottom of the plastic one, make sure it says BPA free. And don't microwave your spaghetti in your plastic containers. Put it in real glass. And at work, if you don't have real glass containers, buy some and have them at the work station where you're going to microwave your leftovers. And in the environment, you know, we do see that air pollution can be monitored, particularly in big cities. So we want to kind of pay attention to that. Some recommendations are to stay indoor when the air pollution is high, because that can be an issue with outside air quality, but also indoor air quality as well. When things have been sprayed with pesticides in your backyard or in the parks, be aware of avoiding these pesticides on lawn, and using natural cleaning products can be very, very important as well. Another interesting recommendation is avoiding flame retardants in items. So let's be careful with that as well, because these, as they get on your skin or even on your children's skin, it can cause issues with their reproductive hormone levels. So I think, you know, as we've looked at all of these different myriad of suggestions, we can find it very confusing, I think, as care providers, and also for our patients as well. And we absolutely get conflicting information. So as we try to guide them and we guide ourselves, I think we need to be, number one, just being mindful of these topics can really help shine some light on these topics to help to optimize, improve fertility outcomes. We are continuing to see translational medicine and evolving data on topics from vitamins and micronutrients to diets. And I think some of these recommendations continue to help guide us. Direct linkage, obviously, to fertility outcomes in live birth remains to be seen. And I think keeping things simple in some of the things that could be really impactful. And also, patients always want something to do. I was talking about my patient who earlier said, I just need a break. I need to take a couple months and just regroup with my family. And what else can I do to get a sense of control? So I think being mindful of some of these incredible solutions that we've brought today, so that we end up with no harm in overall health improvement. So at Vios, our approach, of course, is on patient education and context. You know, Nelson Mandela said, the most powerful way to change the world is education, and understanding the why behind something so simple as wellness. And with, you know, with Dr. Hayes and Dr. Klenov's leadership, we feel that at Vios, this Center of Excellence is incredibly powerful and impactful. And we would love to collaborate with you, some of our local practitioners, to provide incredible care that complements the care they're getting with us, and to help get to healthy mom and healthy baby. We're happy to take any questions.
All right, that was great. Thank you guys so much. Let's see what we have for some questions here. Okay, we have just a couple. All right, here is one. It is, how do you approach the conversation regarding BMI with patients?
I can jump on that one. So I feel a lot of times, just in my interviews with patients, they tend to bring it up a lot too. Like, it's the elephant in the room, and they say things, you know, like, here's what I'm doing to work on it. And, you know, I've tried X, Y, and Z, and doc, I don't have luck doing this. I don't have luck doing that. A lot of times they're coming to the table knowing that that's an issue for them and kind of seeking advice on how to improve their current strategies. If they don't, I will often say, hey, what are you doing for weight loss or exercise? Are you doing anything? You know, it's in our intake paperwork, so that's a nice jumping off point. I say, oh, I see you started doing yoga recently. How's that going? And tell me about the kind of, you know, the drinks you're drinking throughout the day. What's a typical meal? I kind of try to say it in an off, like a low pressure situation to help them open up, because they know it's coming for the most part. They've already struggled. They've already been dealing with it. So if they don't bring it up themselves, they will kind of naturally bring it up in a low pressure way.
I think that's a really great approach to such a sensitive thing.
I think that I just want to say a couple things, because I totally agree with Dr. Klenov. And I think at Vios, I mean, I know that there are some fertility practices that will actually turn patients away, and just based on BMI alone, I think that's wrong, and we all think that's wrong, because it's a collaboration with our patients, and it's our responsibility to talk about this and to help them kind of reach their goals health-wise as well as fertility-wise. But our intake forms that we have our male and female partners fill out not only kind of give us an idea about height and weight, but also about diet restrictions and any special diets that they follow, exercise. And that's a really great, like you mentioned, Violet, a great segue into it. You can say any special diet you follow, food restrictions, food sensitivities, because all of those things are really important. And that's a nice natural way to transition into talking about it, because they want to talk about it. They want help. And they know, I mean, most of them are aware that this could be impacting their chances. We also work with providers in the area, like dietitians and other practices that do naturopathic care, and can really kind of drill down on some of that. So I think, you know, when we've exhausted what our recommendations can be, general guidelines, we also really collaborate really well with some other providers with special expertise in nutrition.
And sometimes patients, even with diet and exercise, they're in a situation where they may need even help with bariatric surgery. So that has also come up as questions for some of our patients that may need even that type of intervention.
All right, I have another question, and it is, do you provide male factor patients DNA fragmentation tests early on in the IVF process?
I think DNA fragmentation can be incredibly helpful, because sometimes it's not even seen that there's a concern on a sperm count, where you can check count and swimming, the motility and the shape with those numbers, but getting some qualitative measures that the DNA may be off, and some interesting work being done even with miscarriages that may be an issue. So that is something that is available at Vios.
Great. All right, it looks like we have one more question, and that is, most of my patients don't have fertility insurance coverage, so cost is always a concern. Many look for natural ways to enhance chances of conception to avoid the expensive treatment. At what point, though, does it seem the wellness efforts aren't going to go far enough?
That's a great question. I think, you know, the general guideline is to kind of direct your patients to see a fertility specialist if they've been trying for pregnancy for a year or more, and they're less than 35. 35 and older, we say 6 months. And so I feel like the wellness aspect it's more of a big picture, but it's not necessarily something that should be done for long periods of time in place of true medical care. And so if patients are uncertain, it's best that they're seen for a consultation with a fertility specialist, and then we can help them kind of figure out the timeline for some of those changes. Because what we don't want to have happen is patients to say, well, you know, they said I could just help with healthy diet, exercise more, reduce my stress, but if they're in a time frame where they may miss an opportunity, you know, ovarian reserve wise to use their own eggs, and this is what they're doing, you know, we certainly, none of us want that to happen. We want people to be able to move forward with treatment while they still have the opportunity to do so. So I would say, you know, the same time frame still applies, where they should come in and see a specialist, and then we can talk in more detail about their individual case.
Great. Does anybody else want to weigh in on that question?
Yeah, and I think some of it also, like you said, access to care and being, you know, without coverage, how do people navigate? There are many new ways, including companies like Starbucks that has IVF coverage to allow for access to care if the financials are also, you know, hitting that financial concern, people that don't have them. Number one, like Dr. Hayes said, come in and talk about your story because there might be things to work on. Number two, again, companies such as Progeny also are offering your employer opportunity to have IVF coverage. And finally, there are some really amazing financial plans like Future Family that give access to loans that are easy to pay off over the time, that sort of like a financing plan. And those have also really helped with access to care.
I think that's really great. I think that sums up our questions. And I think that this was so great. Thank you, Dr. Hayes, Dr. Klenov, and Dr. Beltsos. I think that wellness is so important. And right now, I think it's really a gift to give these tips to patients because it's something tangible that they can do. And there's, you don't feel so in control when you're struggling with fertility. So thank you all for your time. And that wraps us up for tonight.
That was awesome. Thank you for having us. Thanks for joining.
Have a great night.
Thanks.